So I'll be presenting a hybrid perventricular device closure of a large ventricular septal defect in an infant. So 3 months old female, she was weighing 3.4 kg, that's less than third centile for her age, and she had history of recurrent respiratory tract infections and severe failure to thrive. On echocardiography, she was diagnosed to have a large 8 to 9 millimeter mid-muscular VST, shunting mainly left to right, and a large PDA shunting left to right. Dilated main pulmonary artery, severe pulmonary hypertension, and left-sided volume load. So she was started on medical management with preload reducing agent, and considering her severe failure to thrive in large volume left to right shunt, it was planned to close the VST through hybrid approach along with PDA ligation. VST location and size was found to be suitable for perventricular device closure. As the baby was weighing 3.5 kg, the main challenge for transcatheter closure was the arterial line. So we could not place 5 French or more arterial line, that is 6 or 7 French for VST device, appropriate size VST device. So a detailed pre-procedure transthoracic echocardiographic assessment was done. This is echo clip showing mid-muscular VST. And this is a little malaligned with highly mobile margins. So the same VST with color Doppler showing bidirectional shunt, mainly left to right. Here main challenge was the identification of the puncture site, and this step was the main hindrance which was holding us back. And general anesthesia after pre-anesthesia evaluation was given, midline sternotomy was done, PDA was identified and ligated by cardiac surgeon, right ventricle free valve was exposed. Puncture site was identified by pressing upon RV free wall and epicardial echocardiography to ensure the site is as perpendicular to the VST as possible. The surgeon palpated the point of maximal thrill opposite the VST. So this is the same defect in the short axis. Here is our surgical team starting the procedure with sternotomy. Pleated purse string suture were placed around the identified puncture site. 100 international units per kg IV heparin was administered. So, this RV free valve was entered with 18 gauge cannula, and 035 straight tip pterymo guide wire was introduced into RV under epicardial echo guidance. Wire was advanced from RV through VST to left ventricle cavity. Then 8 French short sheath introduced into the left ventricle over Trumo wire. The main problem over here is not to puncture the left ventricular posterior wall. So we have to be very accurate in measuring the short sheath before introducing it into the heart. So size 8 implanter AST device loaded and introduced into the short sheath. First left ventricular disc, and then right ventricular disc was deployed. This is the LP disc and this is the RV disc. Color Doppler revealed a residual leak, but as there was the maximum diameters of retention disc we could afford in this septum, after evaluation of both AV valves, device was released. So this is how the device looked after final release, just appropriate for the defect, the left ventricular disc, the right ventricular disc. So the short sheet was removed and hemostasis was secured by cardiac surgeon, followed by chest closure. Total procedure time was 1 hour. Patient remained hemodynamically stable throughout the procedure, and post-procedure child was shifted to Paeds ICU. Post-procedure recovery was complicated by pulmonary hypertension and intravascular hemolysis. Echocardiography revealed a residual leak all around the waist of the device. Hematuria observed due to intravascular hemolysis in first 48 hours, which was managed conservatively. Mechanical ventilation for 24 hours. Pulmonary hypertension managed with high-flow oxygen, milrinone infusion, and oral pulmonary vasodilators. The patient was discharged on 8th post-procedure day. This echo was recorded on a follow-up visit at 5 weeks. This device is well in place, with no residual leak, with normal pulmonary artery pressures. And this is our patient at 5 weeks post-procedure follow-up. She's doing great, has gained weight of around 800 grams in last 5 weeks. And this is our team.